Okay, so this is working the feet. You can start with pulling the toes, twisting, torquing. A lot of times bunions can be caused by the liver line right here along the top of your foot being shortened. So I like to twist my big toe and kind of pull it out a little bit, as I was getting a little issue there in that big toe knuckle. You can even kind of move around it a little bit, but you can kind of stretch and twist your toes. And our feet are the basis of our bodies. So if our feet are messed up, it just goes right up the body into our knees, our hips, and our shoulders, everything. So I really do like to work our feet. And I'll grab toes, grab the center of the foot, and I'll counter rotate. So my toes are going one direction, and I twist the middle of my foot another direction. Sorry, I wasn't counter rotating there. So I'll twist them both ways. So I'll twist the toes the other way and the middle of the foot. I just think it's so important to work our feet. I used to have nerve pain in my foot from 6 years, for 6-7 years, due to my Achilles tendon pulling away from my heel. My fascia back there was so tight. You can even grab your heel and twist it both directions. And breathe as you're doing these stretches. Again, breathing is what expands the body, allows the fascia to stretch and relax. If you ever feel like a dry burning sensation, it's where you have dry fascia. So now we're going to do the shin area. I lace my fingers, grab right above the ankle, and I kind of pull it in and pull that skin up. And then I'm going to rotate my ankle in both directions. If I find a tight spot, I'll stop there for a second and breathe into it. And if it feels like it's dry and burning, it's okay. Keep working it. That fascia is dry, and making sure your body is hydrated with silica from either like horsetail tea or taking diatomaceous earth. Using electrolytes helps to hydrate our body and our fascia. And I'm going to scoot up the shin a little bit here. And again, just kind of keep rotating that ankle. So if you find any tight spots, just stop and breathe a little bit. And again, a lot of our meridians go through, they all go through except, heart, lung, and some of the ones that are starting from here. So again, lace your fingers. We're going to grip behind the leg. And again, I'm pretty flexible, so just kind of do what you can do. I'm going to pull in and pull up away from my heel, stretching that Achilles tendon. And again, this one is the one that helps my foot pain, and it is gone now. And I had it for over 6 years. So just stretching and manipulating the fascia helps get rid of that. And stop, breathe wherever it feels tight, burning. And then kind of move up for the base of the calf muscle. Again, do your ankle rotation. Breathe as you move. Pause where you need to. Okay, now we're going to switch to the other side. So again, I'll start with my toes, start twisting them, pulling them. My big toe, again, I'll pull out away from my other toes to stretch that liver line in my foot to help against bunions or tightness in that joint. And then just kind of twist and pull the other toes. And again, keep breathing. And do this however long you feel like you need to. And then I'm going to grab my toes, grab the middle of my foot, and I'm going to twist my hands in opposite directions. So I'm twisting that foot, getting the toes and the arch of my foot kind of going in opposite directions, and then I'm going to switch. And when I, push on this, I can feel it all the way through my ankle and up my leg. And that's good. Everything is attached. Fascia goes through everything, and everything's attached, so they all affect each other. Again, grab the heel, kind of twist your heel both directions. And our ankles are also connected to our wrists. So sometimes if you're having a wrist issue, you can work your ankles, and that will help your wrist. Okay, now again, we're going to lace our fingers, pull up on the front of the shin, pull the skin up, and rotate the ankle. And stop wherever you feel like you have a tight spot and breathe. And then slow, kind of move off the shin a little bit, keep rotating and breathing. Now move to the back side of the calf, Achilles tendon, clasp in, keep the thumbs down, pull the skin up and away from the heel, rotate, and breathe here. Pause, tight again. Then we're going to move up to the calf and rotate. And breathe. Okay, so after this, get up, walk around, walk it in, integrate it in, walk for 45 seconds to 3 minutes, and feel the difference in your feet. You may feel more contact with the ground with your feet, that you're more centered, more balanced. Even up into the knees and hips, they might feel like they are working and aligned more properly as we work with our feet. Again, the feet are the base of the body, so it's very important to work the feet to help everything else up above it. If you have any other questions or comments, feel free to leave them in the comment section below, and thanks for watching our video on the feet procedure.